This video is intended to teach therapists how to construct maggot therapy dressings to treat non-healing wounds. It was produced by the Biotherapeutics Education and Research Foundation. Maggot therapy is the use of specially selected and processed fly larvae as a dressing for non-healing wounds. The procedure can be done in the hospital, the outpatient setting, or even at home or in the nursing home. In the United States, maggot therapy must be prescribed by a licensed physician, but it may be applied by the doctor, nurse, physical therapist, or even by the patient or the patient's family. While no specific certification is required to apply or change the dressings, the most successful therapists are those with experience and knowledge about the process. Special pre-assembled dressings can hold the maggots in place, but currently most therapists make their own cage-like dressings out of readily available materials. This film will help those therapists construct simple yet effective maggot therapy dressings. The basic dressing must prevent the maggots from escaping, permit air to reach the maggots, and permit the efflux of wound drainage. Ideally, the dressing should also be inexpensive, comfortable, and should protect the skin. The following multi-layer design has been found to be quite successful. The maggots move quickly, so as much of the dressing as possible should be constructed before placing the maggots on the wound. A skin-protecting liquid or pad is placed on the healthy skin surrounding the wound. This will be the foundation upon which the adhesives will be mounted. The medicinal maggots are placed within the wound bed, along with gauze for them to crawl on. The maggots are covered with a porous mesh or netting, which is glued and or taped to the supporting foundation. It is often valuable to add additional layers of tape or transparent membranes to secure the dressing and prevent the wound drainage from dissolving the adhesives. Cover the cage-like dressing with some loose gauze to absorb the drainage that will result as the maggots dissolve away the necrotic tissue. Replace only the top gauze layer every 4 to 8 hours as it becomes soiled. Remember never to cover the porous netting with any layer that would obstruct the inflow of air or the outflow of fluids, for otherwise the maggots will suffocate or drown. Remember also to read the labeling and packaging literature thoroughly for instructions, indications, and warnings. Now, let's see how to construct the dressing in real time. We will assume that you have selected and prepared your patient appropriately. We recommend that prospective patients be properly educated about maggot therapy and then give written, informed consent. We also recommend documenting the course of this and all other wound care treatments photographically, as well as with your routine written chart notes. Be sure to have all of the necessary supplies readily available at the bedside or work area. These will include your sterile porous dressing, such as a polyester chiffon, netting, or nylon stocking, and your medical-grade maggots. You will need skin cleansers, protectants, hydrocolloid pad, and something with which to cut the dressings, such as a scalpel or scissors. You will also need adhesive tape, glue, and gauze. Clean the wound and the peripheral skin. A liquid skin protectant is a good idea to prevent the voluminous wound drainage from irritating the healthy skin. This drainage is filled with liquefied necrotic tissue, bacteria, and the maggot's strong digestive enzymes. From your hydrocolloid pad, cut a hole which precisely matches the wound. By having this pad extend all the way to the wound margins, you will not only protect the surrounding skin from wound drainage, but also prevent the maggots from straying onto normal, sensory intact skin. Once the hole has been cut from the hydrocolloid or protective pad, place the pad securely on the peripheral skin. You want to have a seamless border around the wound so that the maggots do not crawl out before you are ready to remove them. At this point, you could simply place the maggots in the wound and tape the netting over them. but I like the added strength of a liquid adhesive with which to bond above and below the netting and through the netting pores. Most fast-setting liquid or spray medical adhesives work well. If none are readily available, contact cement from the local hardware store also works well. You want to use adhesives which are not dissolved by the maggot's proteolytic secretions. Now it is time to add the maggots. Get them down from the lid by banging the vial on the counter 3 or 4 times. If you want to see them better, or get them to crawl up the sides of the vial, then warm them up in your hands by rubbing the vial back and forth. Put on your sterile gloves before opening the vial. The recommended dose of maggots is 5 to 10 per square centimeter of wound surface area. Applying maggot dressings for the first time is best done with an assistant, but if you don't have an assistant, you can open the vial without contaminating your sterile gloves if you cover the surface of the vial with a sterile gauze pad. If you need only a dozen or 2 maggots, then you can take them easily from the sides of the vial. Grab a wet 2 by 2 inch gauze pad, hold it between your second and third fingers, and wipe the inner wall of the vial. You can see the maggots through the vial and count them roughly as you wipe them up. Surface tension will cause the maggots to adhere to the wet pad, and they will not be harmed or crushed as they would by a dry pad or cotton swab. The maggots are much too small to count precisely, so just estimate the amount you pick up. You will never be able to get a precise count of maggots going into the wound, and you should never count or expect to retrieve a specific number of maggots as you remove them from the wound 2 or 3 days later. If you need many maggots, then remove the entire gauze pad from the vial. That is where most of the maggots are residing. If the size of the wound calls for roughly half the number of maggots in the vial, then use only half the gauze pad. The gauze in the vial is intended to make the transfer of all the maggots nearly effortless. Add additional gauze to loosely fill the wound space. This will provide the maggots with additional surface area upon which to crawl and take some peaceful breaks between meals. Now cover the wound with the porous netting, making sure not to allow any wrinkles. To the maggots, a wrinkle in the dressing is an escape tunnel. Add another layer of glue and top this with a layer of silk, cloth, or pink tape over the portion of the dressing that is mounted to the foundation. I prefer to avoid placing tapes and adhesives on normal skin. Often, even the healthy skin in a chronic wound patient can be traumatized easily. Therefore, I always trim the excess tape that hangs over the colloid foundation. Again, remember never to cover the center of the porous netting with anything that would obstruct the inflow of air or the outflow of fluids, for otherwise the maggots will suffocate or drown. When I expect that there may be a lot of drainage or that the dressing may loosen from excessive motion, then I cover the tape layer with a transparent membrane dressing. This will keep the drainage from contacting and dissolving the tapes and adhesives underneath. I also cover about 1 centimeter of healthy skin that extends beyond the hydrocolloid pad with this same dressing. Any maggots which manage to escape from underneath a loosened hydrocolloid pad will be arrested by the transparent membrane. Once the cage dressing has been completed, you can add a light, loose layer of absorbent gauze on top. This layer should be light enough that air can reach the cage underneath, even if the absorbent gauze is soiled. Of course, the gauze should not be allowed to remain soiled for long, for otherwise the maggots could suffocate or drown if the wet outer gauze is not changed every 4 to 8 hours and whenever soiled. If the gauze is not wet after 8 hours, the wound tissue may not be moist enough to support the maggots or facilitate their production of digestive juices. In that case, moisten the wound with sterile water or saline before replacing the fresh gauze pad. or place over the cage a slightly moist gauze pad instead of a dry one. The dressing should be removed after 48 to 72 hours. Most of the maggots will be fully matured and satiated at 48 hours. Once satiated, they will spend the rest of their time in the wound trying and prying to escape. You can tell that the maggots are ready to be removed because they will now be the size of plump rice, clearly visible just underneath the porous roof of the dressing. As before, you will want to have all of your supplies by your side when you remove the maggot dressings. Wet gauze pads will help you clean up the maggots easily. I like to wet one set of 4x4 gauze with hydrogen peroxide and another set of pads with water or saline. Once I have everything set up, I carefully loosen the dressings from the skin so that I can later remove them quickly and effortlessly. Once the dressings are loosened, with one hand I peel back the dressing like a banana peel while I wipe up the maggots with the wet gauze pad in the other hand. As I peel back the dressing, I sandwich the maggots between my two hands. Then I dump the entire lot into the rubbish bag, often without losing a single critter. I like to wipe first with the hydrogen peroxide gauze pad, as it may kill some of the residual bacteria and may also stun and slow down the wandering larvae. Then I wipe or irrigate the wound some more using the water or saline-soaked gauze. Remember, maggot dressing waste is infectious waste, just like any other wet dressing waste. To minimize the risk of these mobile fomites getting loose, you should double bag them, tying each of the two bags securely. Be sure that this waste is removed from your facility that same day. At this point, careful inspection of the wound will reveal whether any additional maggot treatments will be necessary. Non-planar wounds, like toes, heels, and stumps, are particularly difficult to dress because most netted fabrics will wrinkle as they wrap around the surface of these wounds. We recommend using nylon stockings as the porous layer for such wounds. The stocking can be sealed proximally and distally to a circumferential strip of hydrocolloid. Today, thousands of wound care centers are using maggot therapy to treat a wide variety of non-healing wounds. These dressing methods can be modified to meet the needs of the individual therapist, patient, or wound. For additional information, literature, or training, contact the Better Foundation. If your facility does not have a procedure and protocol for performing maggot therapy, one may be obtained through the Better Foundation or downloaded from the Better Foundation website.